Welcome back to Talking Science with Yoks, episode 3. Hi, Yashu.
Hi, Yokshita.
How are you today?
Good. Thank you for inviting me on your show.
We've been friends for a long time, but I still don't know what type of dentist you are.
Oh, yeah, I'm a prosthodontist. It's short for prosthetic dentistry. And it's got to do with anything that is a prosthesis, replacement of something that is missing, either a tooth or a nose or an ear or a eye or, anything that is missing within your face and neck region, we replace it. That is what a prosthetic dentist does.
And you need a master's to specialize in this?
Yes. There are 9 fields in dentistry apart from like general dentistry. General dentistry is the first degree, the bachelor's degree. And for a master's degree, we have 9 different fields. And one of them is prosthodontist.
So, what subjects do you focus on when you go for your master's?
Basically, there is a few clinical subjects and a few non-clinical subjects. If you want to talk about the clinical side, there is endodontics. Endodontics is basically to do with uh, root canal treatments and anything that is endo, that is within the tooth. Okay, so endodontics, and then there's prosthodontics, which is prosthetic dentistry, pedodontics, which is children dentistry, pedo, and there is oral and maxillofacial surgery. Surgery is basically any surgery which is anything related to tumors and anything related to your head and neck tumors and removal and anything surgical procedures they can take care. And then we have periodontics, which deals with the gums. Yeah, those are the clinical fields. And when it comes to non-clinical, there is OMDR, that is oral medicine and radiology. Now they are specialized in diagnosis of anything starting from oral cancers or any leukoplakia or any oral lesions. They diagnose it, and radiology based study. Basically, they concentrate on diagnosis and treatment planning. So that is medicine and radiology. And then there is oral pathologists. Pathologists are basically microbiologists, but then pertaining to oral, anything oral. And then there is community dentistry. Community dentistry is, you know, uh, basically about educating people, and there is spreading the word about about dentistry, and giving this overall view and scope of dentistry. These guys are the ones who actually take the WHO decision. So these guys are very powerful. Although they are a non-clinical field, they are very powerful people.
So, if you want to do research, do you have to have an association with academia?
Basically, we can do research in when you take up masters. See, as soon as you take up your master degree, you have your thesis and you have your short studies, and you have your research papers. So all of these are basically research. Okay, so there is no particular field where you can separate research and academia. It goes hand in hand, at least pertaining to dentistry. You can publish papers even when you're in your bachelor's, but then if you have to publish papers pertaining to dentistry, it has to be along with your BDS degree, because you need the support of your professors, and you need the readers and the publications. All of it wants your academic what do you call it, the academic status included within your research papers. So we cannot separate academics and research. It goes hand in hand.
So, something your clinic offers, it's called smile designing.
Yes, smile designing. Smile designing is one of the prosthetic branches. Smile designing is a very small branch of prosthodontics. Basically, this is regarding um, you know how we can design a smile based on a person's appearance. It's especially when you have like gaps between your teeth, or you have chipped off or broken teeth, and you feel like some of your teeth are smaller and others are bigger, and you're not very comfortable with a smile, or when you smile and you feel like a lot of gum exposure is there, and you call it gummy smile. If you have all of these issues and you're not very comfortable with smiling, we can do a very calculated method of designing your smile. I'm sure you've heard of the Hollywood smile. They have these pearly white teeth starting from your premolar to premolar. When you flash your smile, you have like this $1 billion smile. So that is basically smile designing. And it's about aesthetics, and it's about the shade matching, based on the complexion that you have and the amount of tooth that is exposed and how appealing that smile looks on your face. It goes hand in hand. Aesthetics as well as the function goes hand in hand in smile design. So basically, we want you to eat well with those teeth as well as look well when you look beautiful when you smile. So that's smile design. And also, with smile designing, implant dentistry is a huge thing in prosthodontics. Basically, implant is, when you replace one or all of your missing teeth using a titanium screw, which is this biocompatible material, which is placed within your jaw bones. Okay, so it's going to go in a very, like, we measure the size of your bone, the width of your bone, and the height of your bone, which is available. And depending on what the size and the quality of the bone which is available, we put in a titanium screw which is going to act as this anchoring mechanism. And on top of this, we are going to give you a prosthesis which is going to simulate and replicate your missing teeth. So implant dentistry is a huge recent advancement in prosthodontics.
So when you do smile designing, you're changing up the way your teeth is aligned.
Yes.
Does that automatically change the way the muscles move around the teeth?
Smile designing basically, no, it does not change the way the muscles move around the teeth. You align the teeth without moving the teeth. That is that is what smile designing is. See, there's another branch in dentistry called orthodontics, in which what happens is, you have very protruded teeth. Protruded teeth in the sense, when you smile and you feel your front teeth is too in front, and you have a lot of gaps between your teeth. They put these tiny brackets on your teeth, and basically it's braces, which moves the position of your tooth to a different position, and then it's basically that when you wear braces and you actually move your tooth to a different position, the muscle activity around your mouth changes. But then when it comes to smile designing, there is no particular muscle activity which is changing. It is basically just a veneer, a thin laminate or a veneer which is very strong, which can take up your masticatory load, that is your chewing forces, as well as it can alter the look of your tooth. Suppose you have yellow teeth, you can alter the shade of the teeth matching your complexion. So basically it's this thin veneer which is like 0.5 mm to 1 mm, which goes on top of your tooth. So your tooth is not dead from the inside. It's still alive. It has your nerves and your blood vessels and all of it inside. And in spite of it being alive, you give a veneer on top of it, just to improve the appearance and the function of those teeth. So your muscle movement and your muscle activity has no connection with your smile design.
Do you ever fear that somebody would get it for the wrong reasons? I don't know if
Sorry.
I'm phrasing this right. Like just the psychology behind someone who would get it for the wrong reasons. Do you ever think about
Uh,
that? Or
get it for
someone
the
like a kid being forced to get it done by their parents?
being forced to get it done by their parents. Okay. Uh, See, we wouldn't recommend it if it is being forced, only if it is required. Okay. There's also this specifications, say specifications. Smile designing we don't do before you've reached like around 18 to 21 years of age, because your jaw bones are still developing in those, during that phase. Orthodontics, yes, ortho braces, those that we can start from as young as 12 years old. But then prosthodontics, we don't do it as young as, we don't do it before 18 or 21 years old, because that is when your bone is completely developed. So after that, there is no particular reason why we shouldn't go for smile designing. So if at all, a parent or a friend, or you, because of peer pressure, you're getting it done, that's the wrongest of reasons to get a smile designing done. It's all about you and your looks, and um, it's it's about how happy you are with your current teeth, or how you want to improve it and look better.
I don't know why. I just keep thinking about people with mental health illnesses that they just don't like something about them and this option is available to them. And it's just
Mm-hmm.
so pleasing that, okay, maybe I'll get this done. And they're still not happy. So, okay, I'll get this done to my body.
nowadays we are all about, although it wasn't there when we used to go to school, people are promoting body positivity, and people are, addressing mental health issues more openly now, and people are voicing it more openly. And before going ahead with something that you're not unhappy with, I think you should talk to your the people around you whom you trust. you know you need to speak with them, and you need to understand that if it is really required, and if you're doing it just out of you know um, being unhappy with yourself, that is not the right reason to do it. Obviously, we are here to educate you. Every time you go to a dentist, we tell you whether you need it or whether you don't need it. But by the end of the day, you need to be happy with what you're getting done, and you need to be satisfied with it, and you need to be convinced that you really want it. And speak to people whom you really trust around yourself, and get opinion from people that, do you really need it, or do you really require it? If that's how you go about it, I think.
Orthodontics, why is it okay to put braces on a 12-year-old? Isn't it a lot of pressure on the jaw?
Basically, I'll tell you why. By the age of 12 or 14 years old, all of your milk teeth are out. Okay, you have a completely permanent teeth. That is, you're past the phase of mixed dentition. Okay, your mixed dentition phases till the age of around 14 years old. After that, mostly all of your milk teeth are out. Now your permanent teeth are erupting. When your permanent teeth are erupting, and your orthodontist feels that your teeth are coming out in places where your chewing ability is compromised, that is when you recommend, an orthodontic treatment. Basically, when your teeth are erupting, that is, your main teeth are erupting, right? Those teeth need to be guided in a certain way when the teeth are not erupting in the way that it should be. Anatomically, when it's aligned well, then there is no problem at all. You don't need orthodontics. But then if at all your teeth is erupting in a way in which it's going to cause crowding in the future, and it's going to hamper the functioning of your teeth, that is when you basically need orthodontics. And that is the developing phase where your teeth are like erupting, and your bones are still remodeling. And that is the phase where when you move the teeth and keep it in that place, that it won't relapse, that ortho treatment won't relapse. So it also depends on the patients. There are a lot of factors that this the success of the treatment depends on. Even after orthodontics, there are a lot of cases which comes back with a relapse. That teeth tends to the teeth tend to move back to its original position. So to prevent that, there's something called permanent retainers, fixed retainers, removable retainers. There are so many things that which helps you retain the teeth in its current position, the treated position. So you need to go on regular monitoring, and you need to have those the orthodontist check your teeth of regularly, so that he tells you that, okay, this is happening, this is not supposed to be happening, and you need to do something about it at this phase. If at all there is a relapse, it's very difficult to correct it. Every 3 months or every 6 months, you need to go for your scaling, or your routine dental checkup, so that that if at all there is some uh, adverse situation happening in your mouth, even though you won't be able to recognize it at that moment, your dentist will be able to tell you about it. So that is very important. Follow up is important, monitoring is important. And this follow up is not just for a day or two or a year or 2 years. No, it's like your throughout life. You need to follow up every 6 months with your dentist throughout life. That is when you can actually prevent that from happening.
Jaw is still growing. Why is it okay to put braces at such a young age? Why is it rather not recommended to let them grow and then correct it with braces?
There is something called adult orthodontics, and there is something called like general orthodontics. Now, adult orthodontics goes up to the age of 50, 50-year-olds, 60-year-olds, even 50 and 60-year-olds can wear braces. Now currently the treatment option is not just braces. There is other treatment option like aligners, and there is so many other treatment options apart from your conventional braces that were there previously. So what happens is, when your jawbone is developing and the orthodontist that you consult, he feels that the erupting teeth are not erupting in the right position. It's not erupting in the current position, in the position that is supposed to erupt, so that your upper teeth and your lower teeth have the physiological contact. That is, while you're chewing or basically we call it a class 1, class 2, and class 3 relationship. Okay, that is your first molar, how it is related to your lower first molar, the upper first molar and the lower first molar. Now, whenever this relationship is altered and you don't have this um, exact relation, that is the class 1 relation is not there with your upper and the lower teeth, that is when the orthodontist decides, okay, we need to move this teeth slightly forward or we need to move this teeth slightly backward, so that he gets a relationship between the upper and the lower teeth, so that your eating abilities is, enhanced, and also your looks are enhanced. All of these factors come into play.
Do you or your colleagues ever advise female patients to get their treatments done in according to their menstrual cycle? Because I read a couple of papers about how the hormones come in effect with pain tolerance or bleeding gums.
Menstrual cycles, I wouldn't say, but during pregnancy, yes. Menstrual cycles, pain tolerance, basically anesthesia, whatever we give in India, we use local anesthesia, lignocaine. Okay, so this lignocaine, uh, it doesn't react or it doesn't correlate with your menstrual cycles. Irrespective of whether you have your cycles going on or you don't have your cycles going on, your local anesthesia is going to work very locally. So we are not in India. We don't, I mean, use the nitrous oxide inhalation anesthetic agents. So we don't have the general anesthesia happening unless it's for a surgical procedure. We use local anesthesia. Majority, 95 to 97% of dentists use local anesthesia, and most of the procedure require only so much. So what we do is that doesn't correlate with your menstrual cycles or your pain tolerance, because irrespective of whether you have your cycles or not, your toothache is your toothache. So that is something that I or my colleagues that I know of, we don't appoint the patients depending on.
Even for simpler treatments like scaling or cleaning, I read a couple of articles. I did not scientifically verify this, but it was just a couple of articles
Okay.
where people were
Mhm.
saying that the different hormones that you're going through, your different cycles, if you're just going for cleaning, maybe at a certain time during a cycle, you'll be more prone to bleeding. Or maybe when you're ovulating, you have a toothache, an unexplained toothache for no reason.
Mhm.
Did you ever hear about this?
No, actually, this is the first time that I'm hearing about, any anything related to toothache and ovulation. I probably have to read about this. I haven't read any papers regarding any connection between your ovulation or your menstrual cycles and your toothache. That correlation is probably there, but I haven't read about it, so I don't think I can comment about it without knowing about it.
Do you have any general tips for
Okay.
people to
Um,
take care of their um, oral hygiene?
General tips. General tips is basically brush twice a day, of course. Please, everybody brush twice a day. And visit your dentist often. That is the most, the most relevant tip that I can give you. Visit your dentist every 3 months, because if at all you have your decay starting, a decay tooth starting, and you let it decay for more than a period of 3 months, then it's going to end up in an RCT and an infected tooth, and which is going to be so difficult to treat, because when you have an infection, your anesthesia doesn't work as efficiently as it should. And it's such a hard situation for your dentist as well as you, because you're going to have a painful procedure. So before it reaches a stage where it's going to be, irreversible, try to visit your dentist regularly so that they can check upon your teeth and they can tell you there is something wrong, and it can be fixed at a very early period. Like if you have a small decay, you can get it fixed immediately. Before it progresses to an infection that is within the tooth, which progresses to an infection within the bone, and then you have your space infection, and it's an endless circle. So you before that happens, visit your dentist regularly and make sure you use your mouthwashes and you make sure you floss and you know just your um, routine and don't and one more thing is I recommend that I always tell this to my patients, please don't brush your teeth very hard because your teeth are not diamonds. It is as precious as diamonds, but they're not literally diamonds. So please don't brush on them that hard that your enamel have to wear away and you'll have so much of sensitivity on your teeth. Make sure that you use soft bristle toothbrush and you make sure the head of your toothbrush is small enough to reach your back teeth so that your back teeth don't decay, because that is more prone to decay because you can't see them. It tends to decay more you know uh, easily. So I would say that you buy a toothbrush which has a very small head, and try to buy a toothpaste which doesn't have much of abrasives in it, and which has triclosan and fluoride in it, and which is in basically in a gel form so that it doesn't have the abrasive particles in it. The paste form tend to contain the quite abrasive particles which tend to wear away your teeth more effectively. So try to use the gel form, which is less, which is easier on your teeth basically.
Thank you so much, Yashu, for doing this after a long day of work.
Oh, my pleasure.